Hello friends, in this section of head and neck, I am going to explain the nose, the nasal cavity. In the nose, the question often comes about the nasal cavity. So you should have a detailed description about the medial wall, the lateral wall, the root of the nose, the floor of the nose. You should know the arterial supply of the nose, the different walls of the nose. You should know the arterial and nerve supply of the medial wall, and you should know about the lateral wall. So it is very important. Also, you should know some of the openings which are present in the lateral wall. So starting with the nasal cavity, this nasal cavity has got a roof, it has got a floor, it has got a medial wall. The medial wall of nasal cavity is also called as nasal septum, and it has got a lateral wall. So starting with the roof, when you will see the roof, it is sloping in downward direction and it is formed by following bones. In the central part, it is formed by the cribriform plate of ethmoid bone. In the anterior sloping part, it is formed by the nasal bone and it is formed by the frontal bone. In the posterior part, it is formed by the basi-sphenoid and the basi-occiput. So these are the bones which is forming the roof of nasal cavity. Once more, in the central part, it is formed by the cribriform plate of ethmoid bone. In the anterior sloping part, it is formed by the frontal bone and that of the nasal bone. In the posterior sloping part, it is formed by basi-sphenoid and basi-occiput. So this was the bones forming the roof of nasal cavity. Coming to the bones which are forming the floor. Actually, the floor of nasal cavity is formed by the hard palate, and this hard palate anterior part is formed by the palatine process of the maxilla, and posterior part is formed by the horizontal plate of palatine bone. So these two bones, that is horizontal plate of palatine bone and palatine process of maxilla, is forming the floor of nasal cavity. Formation of nasal septum, that is the medial wall of the nasal cavity. The medial wall of the nasal cavity is formed by two bones, that is the vomer bone and by the perpendicular plate of the ethmoid bone. So the two bones which is forming the nasal septum is perpendicular plate of ethmoid bone and the vomer bone. On the anterior aspect, these bones are forming the posterior part. On the anterior aspect, it is formed by cartilage, that is the septal cartilage, and also by the alar cartilage. So these are the cartilages and the bones which is forming the nasal septum. Now coming to the details of blood supply. So nasal septum has got a great blood supply. So many arteries are giving blood to the nasal septum. The important arteries which is giving blood supply are following. That is sphenopalatine artery, branch of sphenopalatine artery, branch of greater palatine artery, branch of superior labile artery, and the branch of greater palatine, and also anterior ethmoidal artery. So these all branches are supplying the nasal septum. Once more, the branches are anterior ethmoidal artery, sphenopalatine artery, greater palatine artery, and the superior labile artery, which is a branch of facial artery. What is seen that in the antero-inferior aspect, on the anterior aspect of the nasal septum, there is anastomosis between these branches. So there is anastomosis between the branch of anterior ethmoidal artery, there is anastomosis between the greater palatine artery, the superior labile artery, means all these arteries are anastomosing at the antero-inferior aspect of nasal septum. The branches of greater palatine, sphenopalatine, and also the superior labile and that of anterior ethmoidal artery. So antero-inferior aspect is also called as little area or Kieselbach's area, because there is rich anastomosis on the different arteries on the antero-inferior aspect of nasal septum. Now coming to the details of lateral wall. The lateral wall of nasal cavity is formed by following bones. The bones which is forming the lateral wall are following. They are palatine bone, vomer bone, medial pterygoid plate, we have got maxilla, we have got part of ethmoid bone, we have got the inferior concha. Means all these bones are forming the osseous or bony compartment, bony part of the lateral wall. Along with it, the cartilages are also forming the part of lateral wall, and the cartilage which is forming the lateral wall are following. It is the alar cartilage and lateral nasal cartilage. So two cartilages, alar and the lateral nasal cartilage. Along with it, we have got fibrofatty tissues which is also forming the lateral wall. Once again, the bones which is forming the lateral wall are following ethmoidal bone, palatine bone, maxilla bone, medial pterygoid plate, along with it inferior turbinate. So all these bones are forming ethmoid bone. All these bones are forming the part of lateral wall. Cartilage, we have got the alar cartilage and we have got the nasal cartilage and fibrofatty tissues. Now these are the parts which are forming the lateral wall. Now what we will discuss, we have seen that when we will discuss the nerve and the blood supply, when we are going to discuss the arterial and the nerve supply, I will describe this by making the quadrants. So I will make a diagram. So in the diagram part, I am going to describe the quadrants and I will tell you which part is supplied by which nerve and which artery. Other than that, let's come into the discussion of important aspects seen in the lateral wall of nasal cavity. Now in the lateral wall of nasal cavity, there are three concas, that is superior, middle and inferior concha. So it is important as a viva question also. The concas are also called as turbinates. How many turbinates? Superior turbinate, middle turbinate and inferior turbinate. So it is a very important question for viva that inferior turbinate is a separate bone. How many turbinates we have got? Three, that is superior, middle and inferior. In this category, the inferior turbinate is a separate bone and superior and medial are actually the part of ethmoid bone. Once again, there are three turbinates. Inferior turbinate is a separate bone. Just dot out this point, and the middle and that of superior turbinates are part of ethmoid bone. After that, when you will see the most anterior part, we have got so many hairs in the anterior part of the lateral wall, and this is called as the vestibule part, means antero-inferior part of lateral wall is called the vestibule part of the lateral wall. It is limited by a sulcus that is called limal nasi, and just posterior to it, corresponding to the middle part, it is called agar nasi. Agar nasi is lying in the middle part of the lateral wall. Now coming to when we will see the lateral wall, what you can see in the dissection also, when you will see the lateral wall of the nose, and if you will break this turbinates, what are the turbinates? Turbinates are the parts of bone. So when you will break this turbinates, you can see a depressed area lying below these turbinates, and that are called as meatus. So very important structures are opening in the meatus. We will make a diagram explaining all the openings of the meatus. So I will make the diagram, but just have a discussion of it. How many turbinates are there? Three. Superior turbinate, middle and inferior turbinates. So there will be three meatus also, and there will be one recessus that is lying above the superior turbinate. So the most lower down meatus is lying below the inferior turbinate or inferior concha. So inferior meatus, what opens into inferior meatus is nasolacrimal duct. The opening of nasolacrimal duct location is in the inferior meatus. And where is the inferior meatus lying? The inferior meatus is lying just below the inferior concha. So only one structure opening into the inferior meatus, that is the nasolacrimal duct. When we will see the middle part, means the part of the lateral wall which is lying below the middle turbinate. So middle turbinate or middle concha, anything which you can say, this middle part has got an elevation. That elevation is called as bulla ethmoidalis. Bulla ethmoidalis is the elevation. Just below that bulla, we have got a depressed area that is called as hiatus semilunaris. Bulla in the middle part, just below the middle turbinate, and below the bulla we have got the hiatus semilunaris. In the hiatus semilunaris we have got three structures opening, and one structure is opening into the bulla. Now in the most anterior part of this hiatus semilunaris, frontonasal duct opens. What opens? In the most anterior part of hiatus, what opens? Frontonasal duct opens. Just after that, in the middle part opens the anterior ethmoidal sinus. Anterior ethmoidal sinus, and adjacent to it, most posterior part of the hiatus opens the maxillary sinus, and on this bulla opens the middle ethmoidal sinus. So just as we have seen in the inferior meatus, only one structure was opening. In the middle meatus, four important structures are opening. On the bulla, middle ethmoidal sinus is opening. On the hiatus, three openings are there: frontonasal duct, maxillary sinus and anterior ethmoidal sinus. Now above the middle meatus, the depressed area is called as superior meatus, and this superior meatus is lying below the superior concha or the superior turbinate. And in this, only one structure open, that is the posterior ethmoidal sinus. When you will see the diagram of lateral wall, what you can see, there is one more recesses which is called as sphenoethmoidal recesses. And in this sphenoethmoidal recesses, which is lying above the superior turbinate, opens sphenoidal ear sinus. One structure open there, that is sphenoidal ear sinus. It is very important. Sometimes only short note comes, just explain the lateral wall. So the structures opening in the lateral wall with a very good labeled diagram and write the notes. So you should know all the openings and structures in the lateral wall. Now after that, after the discussion of the lateral wall, we will describe, again I told you, arterial supply and nerve supply. I am going to describe along with a diagram. I will make 4 quadrants and just tell you what are the nerve and arterial supply. After that, coming to the paranasal sinuses. So after completing the paranasal sinuses, we can altogether do the applied aspect of nose and paranasal sinuses. So just have the description of paranasal sinuses. Why the paranasal sinuses are there? When you will see the nasal cavity, you will see it is surrounded by some spaces that make the skull lighter. So there is frontal ear sinus, there is ethmoidal ear sinus, there is maxillary sinus, there is sphenoidal ear sinuses. So the exact function of it is to make the skull bone lighter. It is also adding resonance to voice. It is giving resonance to voice. It is humidifying the inspired air. So the air which comes inside the nasal cavity is made warm by the circulation of that air in this sinuses. So it is very important that this sinus is well ventilated. In certain condition, it is not well ventilated. We will discuss it in the applied part. Now coming to the location of all these sinuses, starting with the frontal sinus. The frontal sinus, as you can see in the diagram, it is lying above the superciliary arch. Okay. Now these sinus is lying here. What happens? It will lie in the frontal bone, as you can see, above the superciliary arch, and the frontal sinus is going to open by a frontal duct into the middle meatus, which we have already discussed. It is just opening into the anterior part of hiatus semilunaris. The second most important sinus is the maxillary sinus. Among the all sinuses which I have discussed, the most important among them is the maxillary sinus. The maxillary sinus is the largest of all, and it is, I just want to describe the location of maxillary sinus. When you will see the maxillary sinus, superiorly it is bounded by uncinate process of ethmoid bone. Superiorly, it is bounded by uncinate process of ethmoid bone. On the inferior aspect, it is bounded by inferior nasal terminate. Inferior nasal terminate is also called as inferior concha. On the anterior aspect, it is bounded by lacrimal bone. Which part of lacrimal bone? Descending part of lacrimal bone. And on posterior aspect, it is bounded by palatine bone. So we have seen this is the boundary of the maxillary sinus. Once more, the boundary of maxillary sinus. Superiorly, it is bounded by which bone? Ethmoid bone. Which process? Uncinate process. Inferiorly, means on the inferior aspect, it is bounded by a concha, that is inferior concha. On anterior aspect, it is bounded by lacrimal bone, descending part, and on the posterior aspect, it is bounded by palatine bone. So these are the boundaries of maxillary sinus. Opening of maxillary sinus, as you have already seen in the nose discussion also when I was discussing the lateral wall, maxillary sinus is opening into the hiatus semilunaris posterior part. Now coming to ethmoid sinus, discussion of the ethmoid sinus. Ethmoid sinus is having 3 groups: anterior ethmoid sinus, middle ethmoid sinus, and posterior ethmoid sinus. Their number varies. Generally, anterior ethmoidal sinus can go up to 11 in number. The middle is generally 1 to 3, and the posterior ethmoidal sinus are generally 1 to 7 in number. Now we should also know the exact opening of this ethmoidal sinuses. So anterior ethmoidal sinus and that of middle ethmoidal sinus is opening into the middle meatus. Posterior ethmoidal sinus is opening into the superior meatus. We have seen the opening of these all meatus in the lateral wall. So whenever, if the short note comes about the paranasal sinuses, you should start with the function of paranasal sinus. You should describe the opening and boundaries of maxillary sinus, and then all the sinuses openings in the lateral wall will be described. So we have discussed the ethmoidal sinus. The anterior ethmoidal sinus is opening into the hiatus semilunaris. Also the middle is opening into the bulla ethmoidalis part of middle meatus. So these 2 is opening into the middle meatus. Posterior ethmoidal sinus is opening into superior meatus. Now we have discussed all these sinuses, we have left with the last, that is the sphenoidal ear sinus. The sphenoidal ear sinus lies in close relation with the sphenoid bone, and it is lying in close relation with optic chiasma and pituitary gland. Sphenoidal ear sinus, as you have seen in the discussion of lateral wall, it is opening into sphenoethmoidal recesses. It is the most superiorly lying in the lateral wall, and it is opening in sphenoethmoidal recesses. After discussion of all these sinuses, let's discuss the applied aspect of it. So starting with the applied aspect of nose. In the category of nose, what will happen? Nose is quite infected at times. It can be infected, bacterial infection can be there, viral infection can be there. At that condition, you have running nose. Now what I have described, the nasal septum, that the nasal septum has got Kesselbach area or Little's area at the antero-inferior aspect. There is rich anastomosis at the antero-inferior aspect of the nasal septum by the arteries, that is the branch of greater palatine artery, the branch of sphenopalatine artery, the branch of superior labile artery, the branch of anterior ethmoidal artery. So if the children's, more in the children's, if they put foreign object in their nose, or in the case of hypertensive elderly patient, what will happen in the case of hypertensive elderly patient also, there is chance of epistaxis. So in case of epistaxis, we have to do the nose packing. So this is one of the applied aspect of it. The other is that at sometimes we get deviated nasal septum. So if the deviated nasal septum is obstructing with the air passage, it is a critical condition, and in that case what conservative treatment is of no use, and in that case you have to go for septoplasty. We have to make the nasal septum once more, reconstruct it. That operation is called as septoplasty. Now after this, coming to the applied aspect of sinuses. Now frontal sinus, what happens? Sinus means inflammation. If the sinus is generally well ventilated, if it is not well ventilated, in some cases of infection or inflammation, what will happen? Secretion will accumulate it, and it will cause a painful condition. Okay. For case of if the frontal sinus is involved, it is we will accept the pain in the frontal bone, and that is means on the anterior aspect of our head we will feel the pain, and generally that pain is more in the daytime, so it is also called as office headache. So frontal sinusitis will cause office headache. Coming to the maxillary sinusitis, maxillary sinus is the most affected of this sinus. One of the important aspect is that maxillary sinus is located around very important structures, and its opening is also communicating with other openings like nasolacrimal duct. It is in close association with the orbit, as you have seen the bones surrounding it, and at times what will happen, some bones can break, and also its drainage, natural drainage is not at a good location, so we have to drain it by causing some operations which I will discuss. Now maxillary sinus is the most commonly infected or inflamed sinus. It is a painful condition. The patient is very uncomfortable. The diagnosis is generally made by an X-ray. Generally, when you will see the X-ray of head and neck region, you can see the sinuses are well ventilated. It is black in color because of the presence of air. In that case, it will appear whitish in color. Why? Because there is fluid accumulated inside. Mucus fluid is accumulated inside. At times we want to drain. If the person becomes very uncomfortable and the condition is not getting cured by like 7-10 days, then we go for an operations that is called as Androstomy Operation. So in the case of Androstomy Operation, what we do, we put a trochlea, means a trocar or the cannula is put just below the inferior turbinate, so to drain the pus located in the maxillary sinus. If this operation is not successful, we can go for other operation, that is Cadwell Look operations. This Cadwell Look operation, then we give a cut in the upper aspect of the lip, that is called as gingiolabial cut, and through this the sinus pus can be drained. So we have got Cadwell Look operation, we have got androstomy, in which we make a hole, we put the trocar just below the inferior turbinate. So these are some of the treatments for draining the maxillary sinuses. Now coming to the ethmoidal sinuses, generally ethmoidal and sphenoidal sinus or sinusitis is not involved in isolation. They are involved along with the other sinus involved. Means if the maxillary sinus is involved or frontal sinus is involved, along with this, these sinus also get involved. So if generally what happens, if the ethmoidal ear sinus is involved, the person will complain pain at the root of the nose like this. Okay. This is the location. They will complain the pain like this at the root of the nose. And in case of sphenoidal ear sinus, as I told you, it is not occurring in isolation, but the danger is that if the sphenoidal ear sinus is involved, it is lying in close relation with optic chiasma and that of pituitary gland. So it can also affect the pituitary gland and that of optic chiasma, and there can be neurological disorders. If these structures are involved, there can be neurological disorders. Now, the other case which can be explained, sometimes maxillary carcinomas are quite common. In that case, if you go for investigation, you can see a big opaque area in the maxillary area, and surrounding bones can break, and also they can break the cranial foraminas, and the infection can go to the cranium. So these are some of the applied aspect of nose and paranasal sinuses. If the question comes, you have to describe the walls, you have to make a good label diagram, you have to describe the arterial supply and the nerve supply along with the diagrams which I have made, and then you have to describe the sinuses, what is the role of the sinuses, what is the function of the sinuses, and at the end the applied anatomy related to nose and paranasal sinuses. Now coming to the details of, make a diagram showing the lateral wall nerve supply. So for making the diagram, firstly we are going to make the outline of the lateral wall and divide it into 4 quadrants. Okay, 4 quadrants. The antero-superior quadrant has got one of the nerve. The name of that nerve is anterior ethmoidal nerve. Lower down we will make the nerves in the antero-inferior quadrant. In the antero-inferior quadrant, the nerve is internal nasal branch of infraorbital nerve. The posterior-superior quadrant again has got the nerves. The nerve, firstly you make a rounded structure, that is pterygopalatine ganglion, and its branch, the posterior-superior, the branch is posterior-superior lateral nasal branch of pterygopalatine ganglion. Lower down we have got posterior-inferior quadrant, it contains nasal branch of greater palatine nerves. Then on the roof we are seeing so many of the olfactory nerves which is traversing through the cribriform plate of ethmoid bone. So this is all about the nerve supply of lateral wall of the nose. Thank you. Now we are going to make features of lateral wall of the nose. We will make the outline of the lateral wall of the nose. Now inside we are going to make 3 turbinates or concave inside the lateral wall of the nose. So just label it. The most inferior is the inferior turbinate, the superior one is the superior turbinate, and middle one is the middle turbinates. Now there is a space between sphenoidal bone and that of superior turbinate, and that space is called as sphenoethmoidal recesses. In the sphenoethmoidal recesses, so the opening of sphenoidal ear sinus. Thereafter, opening in the below superior turbinate, we have got posterior ethmoidal sinus opening there, and in the middle meatus, that is lying between the middle and inferior turbinates, we have got 4 structures opening in it. So here 4 structures are opening into the middle meatus. The structures are following. So these structures are opening of frontal ear sinus, adjacent to it will be the anterior ethmoidal ear sinus, and then we have got here maxillary sinus, and on the upper part, that is bulla ethmoidalis, we have got middle ethmoidal sinus opening. Now coming to the lowermost part, that is inferior meatus, we have got the opening of nasolacrimal duct. So these are all the structures which we see in the lateral wall of the nose, and we have to show all the opening of important structures opening in which part of the lateral wall of the nose. Arterial supply of nasal septum. So first make the outline of the nasal septum. Just a rough outline, okay. What is important is to show all the important arteries supplying the nasal septum. So the first artery is anterior ethmoidal artery. The second is the superior labile artery, branch of facial artery. Then we have got the greater palatine artery, and also we have got other branches as sphenopalatine artery and also posterior ethmoidal artery. Now what you can appreciate in this figure, that the artery is like the superior labile artery, branch of superior labile artery, branch of greater palatine artery, branch of sphenopalatine artery, and anterior ethmoidal artery, all are converging at an area which I have encircled. That area is called as littles area, and this has got a huge anastomosis, a rich anastomosis between these arteries, so this is more prone to epistaxis. Thank you. Coming to the nerve supply of nasal septum. So firstly, make the outline of nasal septum showing the 4 quadrants. So we'll make the 4 quadrants. In the roof, we see the olfactory nerves passing through the cribriform plate of ethmoidal bone. Then coming to antero-ethmoidal nerve in the antero-superior quadrant. The antero-superior quadrant, we have got anterior ethmoidal nerves. In the antero-inferior quadrant, we have got anterior-superior alveolar nerve. Now coming to posterior-superior quadrant. In the posterior-superior quadrant, we have got posterior-superior nasal branch of pterygopalatine ganglion. In the posterior-inferior quadrant, we have got nasopalatine branch of pterygopalatine ganglion. So these are all the nerves supplying the 4 quadrants of nasal septum. Thank you.